Are you able to see?
Yeah, yeah,
Robin?
yeah. Yeah.
Yeah, okay. So you just tell me when I want to change your slide.
Okay, sir. Okay.
Okay, start. Your time start now.
Yeah. Good afternoon and namaste to distinguished delegates, colleagues, and guests. And today I will address a topic that threatens the very foundations of modern medicine, but often remain overlooked. AMR is a silent pandemic. I am from Nepal and Department of Pharmacy, Kathmandu University, and I start from here. Okay, change slide. As per WHO, AMR is one of the top global public health and threats. The term refers to the ability of microorganisms to resist the effect of any type of antimicrobials that previously killed them or inhibited their growth. That means the antimicrobials that that killed and inhibited the growth of microbials was resist on our body, and it becomes threatened. So it threatens our body. A well-known example of a bacterium that has acquired resistance to multiple antibiotics is meticillin. Meticillin is an antibiotic which is resistant Staphylococcus aureus. Kills more Americans every year than HIV/AIDS, Parkinson's disease. Even it kills more peoples and more Americans every year than that of the HIV/AIDS too. And increased antimicrobial resistance is the cause of severe infections. Severe infections it causes, and also a longer hospital stay. And it increases the mortality. The death rate also increases due to this antibiotic resistance. And globally, 3.7% new cases and 20% of the previous treated cases of tuberculosis are estimated to be caused by the strains that are resistant to isoniazid and rifampicin, both the medicine which are used in tuberculosis patients. So it has been resistant in them. Okay, change. Could you change, please? Yeah. Now, aims and objectives. And the aims of research on AMR is to reduce the emergence of AMR, enhance the surveillance and monitoring, preserve the efficacy of existing antibiotics, promote research and development, improve the awareness and education. And we are also doing the awareness program in Nepal too, in Kathmandu University. We have started a campaign too. And the objectives of AMR should be to evaluate the current trends in AMR, to analyze the economic and clinical impact of AMR, and effectiveness on interventions such as antimicrobial stewardship program. And antimicrobial stewardship program we are doing here in Kathmandu University too by the bachelor's student to identify the key driver of AMR. Key driver of AMR means overuse or overuse of antibiotics, underuse, or withdrawn symptoms in humans, animals, and environments to propose the actionable recommendation to mitigate the AMR. Okay, change. Hello. And materials and methods. And how we conduct our study. The study was conducted detailing the materials and methods used to know. In our research directly related with the data collection and the data and the study design. So study design. This presentation is based on the comprehensive data review that synthesizes the current state of antimicrobial state of AMR. Globally, how much antimicrobial state the world is in. We conducted a systemic analysis of available data from 4 reviewed studies, government reports. There are various reports published by the government, WHO, and International Health Organization, and we collected that data, and we prepared the consequences, trends, and causes of the AMR. Data collection, keywords like antimicrobial resistance, antibiotic misuse, and we have used that. Okay, forward. In data categorization and data analysis we have done. Information is in systematic order, like drivers of AMR, resistance, strength, and intervention effectiveness. In this way, we have prepared. Change, please. And results in the discussion. What we find? We found the different types of the pathogen associated with the resistance, different types of the bacteria, from where 6.6 lakh to 12 lakh deaths attributed to AMR, 3.57 million deaths with AMR in 2019. One pathogen drug combination. I have already given that example of methicillin antibiotic, which is resistant to Staphylococcus aureus, due to which mm, the certain amount of people's death in 2019, only on 2019, and it also showing the resistance in E. coli. And we have to take care that the 92% of the dispenser are of private sector and 8% of dispenser are of public sector, so that we can control the private sector dispensing of antibiotics. That from where we can prevent the antibiotic resistance. Okay, forward. Yeah, I have here collected the data that is associated with resistance. That the top one is the associated with the resistance. That means resistance of the antibiotics. Antibiotics killed people between the 6,000 to 9,000 people killed every time. But attributable to resistance. That means the only the from the use of the antibiotics. That means side effects of the antibiotics. The few people are dying. That means the resistance of antibiotics is more threatening than that of the attributable to the antibiotic. From where we can okay change. Okay, use of antibiotics in Nepal. I am from Nepal, so I have studied a nationwide survey how the people use the antibiotics, from which sector people use. Then people use outlet as trained personnel, but near to the health center, people use more types of the antibiotics available to the of the medicine cheap area and all those things. In summary, the impact of the AMR is significant, posing to human health, food security, common disease are pneumonia, tuberculosis, becoming harder to treat because of the antimicrobial resistance. And what global efforts and we are trying to do. And AMR is a growing crisis that depends urgent global action, shared responsibility among government, healthcare responsibility, industries, and individuals. It's all responsibility to the all the industries and individuals. By using the antimicrobials responsibly, program and stewardship program safeguard the efficacy, we can control it. Okay, I would like to express my gratitude to Kathmandu University for their support, and also I would like to thank Professor Dr. Panna Thapa, Uttam Buratoke, Associate Professor Dr. Durga Bistra, and Deepa Das sir for this. And I took the reference from this website. You can go through it. Okay.
Thank you, Robin, for your nice presentation.
Okay.
Okay, so
Okay.
your certificate will be sent by Karnataka sir. Okay,
Okay. Okay,
so
sir.
all the best. Okay,
Okay.
so
Okay.
now
Thank
he
you, sir.
will. So
Thanks,
all
sir,
the
for
guests,
giving me this opportunity.
yeah, thank you. So all the guests, you may now leave. Okay,
Okay, sir. Okay.
okay, okay. Thank you, thank you.
Okay. Welcome, sir. Welcome.
Yeah.